Hello there, and welcome to your full body cranial nerve examination, where we will be checking all of your cranial nerves and vital signs to make sure that you are feeling well, to make sure that everything is working the way that it should. Does that sound okay with you? Is it your first time with us here today? But have you had cranial nerve exams before? It's very similar, apart from we're not doing a cranial nerve exam for an injury, we're just doing it for a well-being check. So it will include vital signs. So I'm going to start with vital signs, but I need some personal details from you. Alright. Okay. Can you confirm your full name for me? Okay. And your date of birth? Alright, can you just confirm the number that we should have for you on our system? That's correct, we do have that. And your address, please. And the zip code. Excellent, we have all of that there. Now, I don't have any information for you on medical history or current medications. Could you please let me know any current illnesses or anything that you have, and also your medications as well that you're taking? Okay, and that's for... Yes. Okay, and that... You take them both together. Alright. Okay, I've got that down. Now, we have a new machine today that I'm going to use to do your blood pressure and your pulse as well. So I will take a listen to your heart, but I'll do it after we do this. I'm just going to listen for any irregularities, but this machine is pretty good. So we're going to use this here. Okay, I'm just going to pop that through your arm. Like so. Okay, is that comfortable? Alright, so we're going to press start. And it's going to start to increase. You'll get quite tight. You might be able to feel your pulse as well. Okay, we're not bad. 126/72, and your pulse is 72 beats per minute. Alright, so a little bit high with your pulse, but I'm assuming that's just because, yeah, you're in seeing me in terms of seeing a doctor. But 126/72 is absolutely fine. We look for 120/80 is our kind of standard, but that's absolutely fine. Take that off your arm. Down for here. 126/72. Okay, I'm going to take a quick listen to your heart as well now, if that's okay. Okay. Let me just set this here. Just breathe normally. I just want to make sure that everything sounds great. Excellent. I think that sounds great. I'm just going to move this round to your back. I want you to take some deep breaths for me. So just breathe in and out, and in, and out, and in, and out. Lungs sound nice and clear as well, so that's all good. Okay. Let's move on to testing your cranial nerve. So we're going to start with the sensory nerve, and I'm going to give you a few different scents. They're essential oils that I want you to tell me what you think they are. I'm going to pick some very popular ones, so you should have an idea or at least be able to describe them to me. Okay, so the first one, I'm just going to waft it underneath your nose, okay? So just breathe in that scent. And let me know what you can smell. What could you smell? Good. It was peppermint. Excellent. Okay, the next one. Again, if you can't think of the smell, just describe it to me. Whether you think it's floral, citrus, what it reminds you of. Citrusy. Yes, it's lemongrass. I would have taken lemon as well for an answer because it smells the same. Okay. Our next one. It's strong, isn't it? Have a good sniff. What do you think that smells of? Yes, it is lavender. Excellent. Okay, and then next one. What do you think that smells of? Okay. Florally. Yes, well, it is rose, so that would be correct. This one. Just breathe in and out nice and slowly. What does it smell of? Reminds you of Christmas time. Well, I'm not surprised because that is cinnamon. Let's see if we can do one last one. Okay. Here we are. Just breathe in and out. What does that one smell of? Medicinal. Yes, it's eucalyptus. You might smell that in some of your medicines for colds or muscle relief. Excellent. Okay. So you scored 6 out of 6 for that, so that's excellent. Alright. We're going to move on to your eye test. So I'm just going to have a quick examine of your eyes. So if you can just look up for me. Okay, look down. This side. And the other side. Okay, look up again. Look down. This side. And this side. And one more time, look up. And look down. This side. This side. You do have a few floaters in here. Do they bother you? Not too much. Okay, just to let you know. Alright. Well, I have this eye chart. I'm going to sit here, okay? And I want you to read the eye chart for me. So, starting from the top, first line. Okay, next line. S, Z, N, D, well done. Next line. K, C, R, H, N, good job. Next line. Z, K, D, B, C, O. Okay, this line here. H, V, O, R, K, Z, S. This next line. R, H, S, O, D, C, B. This next line, the second last one. K, S, B, R, H, C, O, and finally the last one. H, N, Z, C, D, K, R. Excellent. Okay, that's good. Do you go to an optician regularly? Okay. Alright. Okay, we're going to do some more tests. So I'm going to cover one of your eyes and I'm going to pull my finger into your periphery and you need to just focus. So I want you to just focus here, right in the center, like this, with that eye, and then tell me when you can see my finger. Okay, so pop this hand here. Okay. Do it here. I want you to focus on here, okay? Excellent. Now focus on here, focus on my finger. And it can come in at any point. So focus with both eyes. Okay, let me know if you can see. Okay. Now I want you to focus on my finger. I'm just going to bring this closer into your eyes and away. Keep focusing on my finger. And again. Okay. I'm going to just check your pupil refraction. So just look here, look at my nose. Good. Alright. So eye test. No issues. Very we're going to move on to the sensory test. I'm just going to get a quick drink of water. Alright, so we're going to do the sensory test now, which is where we've got something really soft and something quite hard. And we're going to do it in different areas of your body. So we are going to do it around your face first, but then we're going to do it like kind of your arms and your legs as well, okay? So that we get your full body. So we're going to start with the soft, and all I need you to do is you to tell me if you can feel it where I touch. Okay, let's start with the face. Alright, let's try it with the sharp item. It won't be painful, it'll just be a little bit prickly. Okay. I'm going to try it on your ears now as well, so I'm going to do the soft and the soft on this ear. Okay, and then the prickly bit. Okay, we're going to do your arm, so it's soft. And your other arm. Okay, and then the prickly one. Okay, this side. Okay, we're gonna do your kind of chest and stomach, so I'm just gonna go down your chest with the soft one. And again. Okay, and then now with the prickly one. And again. Okay, now I'm going to do your leg, so we'll do your left leg, so the soft one. And your foot as well. The other side. Okay, now the prickly one. Excellent. Okay, that was really good. So, you felt every single sensory item. You felt everything. No issues there at all. How did you find it? Was it sore or it's okay? Not too sore. Okay. We are going to move on to our hearing test, and how I'm going to do this is I've actually got some items that I'm going to use, and I'm going to make sounds around your ears, and I want you to tell me if you can recognise what kind of sound it is, and if you can hear it. I'm going to have it quite far away and then close to your ear as well, and I'll ask you periodically if you can hear the sound and identify what it is. So we'll start with our first one. So first of all, tell me what this is or what it sounds like to you. Okay. That's about right. So we're going to keep it up close on this side. And we're going to start to move it further away. Can you still hear it? About now. And then bring it back in. Okay, we're going to do it on this side. So nice and close. We're going to start to get further away. And we'll come back in again. Okay. Our next thing. What does this sound like? Okay. We're going to do the same thing. So it's nice and close to your ear. Then we're going to move it further away. Can you still hear that? Still hear that? Okay, it's going to come back in again. Okay, other side. It's nice and close. And we'll move it away. Can you still hear that? Moving close in. And there we are. Okay. What does this sound like? Okay. I'm going to be close to this here. And then we're going to start to move away. Can you still hear it? I'll bring it back in. And then this side. And far away. You still hear that? And back in. Okay. One more. Okay, what does this sound like? Okay, we're gonna move away. Can you still hear that? Okay, bring it close again. Okay, we'll do the other ear. And we'll move away. You still hear that? Okay, let's bring it back. There we are. Okay. Now we're going to do your reflex on your knee. So I'm just going to gently tap underneath your knee, and your leg should move on each side, okay? 1. Do that again. One more time. Good. Let's do your other one. 1, 2, 3. Oh, good. Okay. Now I'm going to place my hands on your shoulders. Now I want you to try and shrug your shoulders against the resistance from me. Okay? Gently try and shrug your shoulders. Again. And again. Okay. I want you to try and turn your head to your right against my resistance. Just try and push your head. That's it. And again. And one more time. Great. The other side. Just try and push. Okay. And again. One more time. Okay. I'm going to put my hands on your cheek, and I want you to try and pull your cheek out against the resistance. Ready? That's it. Try and... Good. Good. Okay, open your mouth wide for me. Maybe look at your tongue. Yeah, just stick your tongue out. Wiggle from side to side. Just looking for any wastage, but I think we're good. Yeah, all clear. Okay, I want you to make some emotions or make some pieces for me. So, big smile. Cheese. Grit together is going to fill your jaw. That's fine. Okay, I want you to scowl at me. So, frown. That's it. Squeeze your eyes shut. Open your eyes nice and wide. Look really surprised. Stick your tongue out again. Great. Okay. Well, your hearing test was great. And your movements are also great. So what I can deduce from today's session is that your cranial nerves do appear to be in working order, and everything in your body is looking great. Your blood pressure's good, your heart sounds really good. So I have no concerns at all about you. I think you're really healthy. And yeah, that's how I feel personally or medically. What about you? Are you happy with today's session? Do you feel a bit more calm, a bit more relieved to know there's nothing wrong with you? Great. Okay, what's the plans for the rest of the day? It's late, so bedtime. Yeah, that sounds good to me. Alright, well, I will write up your notes and I'll put these on file. You can of course come and see us at any time for another cranial nerve exam, especially if you feel that, you know, some of your nerves are not working properly. Just book right back in with us. Okay. Well, it was so lovely to see you today.